Morning, it's Rod here. We're just having an update on our
to get people back to work
coronavirus
instead of a larger swath of the population.
Dr. Sapphire, before the concern became we don't have enough ventilators, the concern was we don't have enough masks, and then the Surgeon General came out and said you don't need to wear a mask unless you've got it. We need to keep them for our healthcare providers. The FDA has, on a temporary limited basis, approved the Battelle mask sterilizing technology to clean N95 masks in Ohio. Apparently they can clean 80,000 respirator masks a day. If that works and this becomes something that spreads across the country, that could actually help us with the mask problem.
This is the doctor, and these are the three hosts. Just notice that this woman starts to cough in the middle of it.
Well, sure, the company you're referring to, Battelle, has just gotten emergency clearance as well through the FDA to sanitize more than 80,000 masks a day. I think they said they could do anywhere from 1 to 400,000 masks a day. This is using vaporized hydrogen peroxide. And yes, getting more N95s out to our frontline workers is absolutely what we need to do, because right now they're just reusing them without them being sterilized, which is also putting them and other people at risk. So this is extremely exciting.
Vaporized hydrogen peroxide. So the RNA virus, which is the anyway, vaporized hydrogen peroxide is quite a good technique where 20 times you can redo a mask. The thickness of the masks, the N95s, so the droplets get caught on the way through. But they're right that the sterilization needs to happen, and the mask's fabric doesn't need to be renewed and reused. So it's a big game changer. And they talked early on about chloroquine, which was a anti-malarial prophylactic, which means that they are able to give it to people that they suspect may have it, or at a high risk, the older generation in nursing homes and stuff. So those are two really big game changers. Very simple, hydrogen peroxide, and a traditional malaria drug which is out there. We're here in New Zealand in South Waikato, so we're watching the epicenter of this, and we've watched the distancing, and then we're watching the medical treatment and innovation come through. So
news, they say that they can do this up to 20 times.
So, Dr. Sapphire, let's take some emails from folks at home who are watching. This is from Cal. He says, if one or two people get the virus in a high-rise, can the heating, air conditioning system circulating air throughout the building spread the virus?
So this is a question that has made headlines recently because a small study out of Singapore actually showed that there was remnants of virus in some of the air ducts of the hospital system that was treating COVID-19 patients. The truth is it is still more likely that this is respiratory droplet spread instead of aerosolized spread, which means that you need to be around someone who has it and it's coming from their breathing or their cough or their...
This is an important point that she makes. The difference between an aeroplane, which recirculates air, is that when a person walks up and down the aisle to go to the toilet and coughs next to each one of those people, and you breathe it in, or you get it in your hands and you put it into your eyes, so that's where the transmission comes through. The ships that they have, the big cruise ships, there's some redesigns of those where people have air that comes in and out from the sea or up and down, rather than it all being in one big cabin and bits and pieces. And in ships there's lots of things you can cough on, and a handrail cough on, and onto a door handle.
Or they're sneezing. Like in airplanes, we have HEPA filters, and in most of the high-rise apartments, the AC units do have a lot of filters that are going to filter out the virus. Is it possible that there's going to be some viable virus in there? Maybe. I think it is extremely unlikely.
Yeah, so that hand washing thing's an important one, and not touching one's face once they've been out and doing those different things. It might sound simple, but it is actually very effective and keeping the social distancing. So there's 99% of it in just those two things. Then when someone does have it, they then have these two medical things like the masks with the hydrogen peroxide and the hospitalization type of things.
All right, let's go to this email from Lee. I've heard that some drugs like aspirin may be lethal if the person taking them gets COVID-19. Is this true? We've heard that about Advil, and we've heard that about other stuff. What do you think?
Right. So there is conflicting reports, and mind you, this is all anecdotal evidence when it comes to taking Motrin, ibuprofen, other anti-inflammatories, that it is actually exacerbating the chemokine release, which is the chemical release inside of your body that's causing some of the severe symptoms in COVID-19. It's conflicting. It's gone back and forth, but I would tend to say that you want to stick to maybe Tylenol, paracetamol, acetaminophen, for any fevers or any symptoms you may have and maybe err on the side of caution when it comes to the non-steroidals. Obviously, talk to your doctor about it. Baby aspirin, if you're taking baby aspirin to prevent strokes and heart attacks, please do not stop taking that. Make sure you are talking to your physician before you change any of your medication regimen.
Yeah, so that's good advice. So we've had 4 really, really important pieces of advice from this doctor, just to recapitulate. And they're pretty much the broad brush information that we've been currently given here in New Zealand and around the world with regards to protection and stuff of that nature.
Always a good advice. Talk to your doctor. And you're our doctor, Dr. Nicole Saphier. Thank you very much for joining us live.
Thank you.
All right.
Right, so if you have any questions, just chuck them in the comments. But there's a lot of information out there. So I'll leave it at that, and I'll look forward to